You've probably heard that high blood pressure is a problem. Sometimes blood pressure that is too low can also cause problems. Low blood pressure or hypertension is a condition in which the force of the blood pushing against the artery walls is too low. It's also called hypotension. Blood pressure is measured in millimeters of mercury. In general, low blood pressure is a reading lower than 90/60 millimeters of mercury. What's considered low blood pressure for one person might be okay for someone else, though. Low blood pressure might cause no symptoms that you notice, or it might cause dizziness and fainting. Sometimes low blood pressure can be life-threatening. The causes of low blood pressure include dehydration and other serious medical conditions. It's important to find out what's causing low blood pressure so that it can be treated if needed. Types of low blood pressure include orthostatic hypertension, also called postural hypertension. This is a sudden drop in blood pressure when standing up after sitting or lying down. Causes include dehydration, long-term bed rest, pregnancy, certain medical conditions, and some medicines. This type of low blood pressure is common in older adults, postprandial hypertension. This drop in blood pressure occurs 1 to 2 hours after eating. It's most likely to affect older adults, especially those with high blood pressure. The risk also is higher for older adults with Parkinson's disease or other conditions that affect the part of the nervous system that controls automatic functions such as breathing and heart rate. This is called the autonomic nervous system. Certain lifestyle changes might help ease symptoms of postprandial hypertension. Eat small, low-carbohydrate meals, drink more water, and stay away from alcohol. Neurally mediated hypertension. This is a blood pressure drop that happens after standing for long amounts of time. This type of low blood pressure mostly affects young adults and children. It might result from communication trouble between the heart and the brain. Multiple system atrophy with orthostatic hypertension. This rare condition affects the autonomic nervous system. Multiple system atrophy with orthostatic hypertension is linked with having very high blood pressure while lying down. It also used to be called Scheidegger syndrome. Low blood pressure symptoms can include blurred or fading vision, dizzy or lightheaded feelings, fainting, fatigue, trouble concentrating, upset stomach. For some people, low blood pressure may be a symptom of an underlying health condition. That's especially so when blood pressure drops suddenly or when low blood pressure occurs with symptoms. A sudden fall in blood pressure can be dangerous. A change of just 20 millimeters of mercury can make you feel dizzy or faint. For example, those symptoms could happen after a drop in systolic pressure from 110 millimeters of mercury to 90 millimeters of mercury. And big drops can be life-threatening. These can happen for reasons such as serious bleeding, serious infections, or allergic reactions. Extreme low blood pressure can lead to a condition known as shock. And before the shock, the person may feel the following symptoms. Confusion, especially in older people. Cold, clammy skin, decrease in skin color, also called pallor. Rapid, shallow breathing. Weak and rapid pulse. Always see your doctor if you experience any of the symptoms mentioned. Want to know the causes of low blood pressure? Watch out for the next video. Celestial Pharmacy 101, your #1 online pharmacy. Stay healthy, stay safe.